What do you see with testosterone deficiency? Do you, if a woman is in perimenopause, let's say, do you commonly see that she could use some testosterone?
Yes,
when does
I
it start?
commonly see that. I mean, it can start even as young, as the early 30s. But I don't have very many people that are in their 20s. But 30s, 40s for sure. And some of the things that I see there are women who, like I said, unlike I was, but who said, I've always had a really good libido and now it's not so good.
Yes.
So that's one thing. Or the sensitivity part of it. I'm having a hard time having an orgasm. That's one thing. But then also fatigue. They just feel fatigued. And that's not going to fix everybody's fatigue. There are women, I just saw one the other day. Yeah, I was on testosterone. It did a lot for my other areas, but it didn't help the fatigue. She's got something else going on.
Yes, of course. Sometimes thyroid, sometimes adrenals.
Exactly.
Yes.
But fatigue, mental clarity. I can't tell you how many people say brain fog. Sometimes the testosterone really helps their focus.
This is The Party with Serene
And Pearl.
Get it right, Poddy.
We are back with a Talking to the Experts potty, an extra special one for you today because, oh my goodness, we are blessed to have right here in the potty barn Dr. Kay Chandler with us.
Yeah.
Hello.
Totally honored. Can I read a little bit?
Yeah, let's
bio?
just go right to her bio, but beyond her bio, she's a friend, and we are just so blessed to call you friend, Dr. Kay.
You too.
I know. I can't believe
Absolutely.
she even talks to us. Because she's so much
love
of a
y'all.
big deal.
Love y'all.
Let me tell you about why she's such a big deal. Dr. Kay Chandler has been serving as an OBGYN for 27 years. So she knows her stuff. And for 20 of those years, she's been a hormone specialist. Named Best OBGYN in Little Rock, Arkansas by several publications. In addition, she's been included on the National Best Doctors, Inc. list since 2005. She's dedicated to promoting health and wellness through true lifestyle change and is passionate about helping women of all ages feel and function at their best by helping them navigate healthcare with an integrative approach and, even more importantly, by educating and encouraging them in self-care. She is on the advisory board for Kiora. We can't believe it. We're so blessed.
Kiora, our hormone program, kind of coming up, about to be launched.
And she collaborated with us with our program for that. So we were just so blessed to have her expertise and wisdom. And since we're going to know her, she's been also appointed as Arkansas Surgeon General. As appointed by Governor Sarah Sanders in February 2023. And she's also leading a charge as a pro-life advocate. And that means a lot to us. She is, like Pearl said, somebody who we know and love. And she's just as special behind the scenes.
Yeah.
As an all that.
So welcome, Dr. Kay.
Thank you. Great to be here.
Yeah.
Been a little
And
while.
that's what you help women with, hormones.
Yes.
And so that's kind of how we got to know you, because Serena and I are hormone freaks, nerds, geeks, whatever you want. And then we were introduced to you, but you already knew about Trim Healthy Mama.
I did. I had patients who had done the plan and told me about it and done very well.
Yeah, so it's kind of like this really great fit, all your hormone knowledge, and then, us being geeks and nerds. And so we really got to sit with you for a lot of hours.
Yes. And I will say I learned from you all a lot too. So it's great.
Thank you.
Great combination.
But today, I mean, we've talked to many doctors, but your expertise on testosterone for women is just so robust. It changed my perspective. I think both Serena and mine.
Because we were such estrogen lovers. And we've given estrogen a lot of love on this podcast.
Yes.
So we wanted testosterone to have its time in the sun here.
Yeah, and we want to talk about like optimizing hormones with you, because that's kind of what you do.
Yes.
First of all, then let's just learn a bit of your history.
Yeah.
Why? I mean, you're an OBGYN. Why did you start with optimizing sex hormones for women?
Well, here's why. Women would come to me and have symptoms, and the traditional things weren't working.
Yeah.
And so, I'd put them on hormones, or women who are not menopausal. We're taught you don't put people who are on hormones, who are not menopausal on hormones, But then I'd have all these women coming with, premenstrual symptoms and, period problems, and decreased libido is a big issue. And when I first started practicing, I had no idea what to do for them. I mean, I would like, well, maybe you could, spend more time together. I mean, just all these things, maybe have activities. I mean, I would read and try to figure it out, but I really didn't have a good answer for people. And it was very frustrating. And so I just happened upon, I think it was one of our pharmacists in town who said, hey, there's somebody coming to talk about hormones and to talk about bioidentical. And I will say there are bioidentical hormones that are FDA approved and that are commercially available. It doesn't have to be compounded. But anyway, he was coming to talk about this. And this guy was a great lecturer. He was involved with salivary testing with ZRT, which you're all familiar with. But he was on staff at Emory in Atlanta. So I was like, well, this guy knows his stuff. And you know what got him interested in hormones is because his wife was struggling. When people have a personal problem, and his wife had, PMS severe, and she was a psychiatrist. So we get trained to treat PMS. You put them on an SSRI. That's one of the things. Or you do dietary things. But it's a hormone thing, but people weren't knowing about this. So all that to say, it was just trying to find a solution that would help people that was outside of what standard of care was.
And this was 20 years ago, right?
20 years ago.
And what happened in your practice? Once you had this new, fresh answer, did you feel all of a sudden like, wow, I actually am making a difference?
Oh, yes. It was so amazing because it would be like people, they would feel so good and they would do so well. And I was thinking, wow, this is just going to become standard of care. Everybody's going to do this because it's going to find out this is the way to treat. Well, now here we're 20 years later, and this is still not considered standard by most, a lot of gynecologists. They don't really check. Well, what we get told is, okay, you get your lab abstract. Well, the reference range is so broad that everybody's levels are normal. So they say, you're normal, but they don't feel normal.
And not only is it not standard of care yet, it's also, there's a lot of battle against it because it puts a lot of the other drugs out of, there's no need.
Right. And that's what I was said, for something to really become where most everybody knows about it, and this is how we treat standard of care, that kind of thing, there had to be large trials, large studies. Yes. But guess who really pays for most of the large studies? Right. Pharmaceutical companies. So if it's not something that can be patented, I don't think it's just hard to get enough data on that for people to feel like this is what we have to do. But it's proofs in the pudding. I mean, and there are studies on the bioidentical. Yes. There are. It's just there's not probably huge trials and things you hear about.
Some were done in Europe, weren't they?
Oh, yeah.
Yeah, quite a few.
Can I ask you one more question before you ask your question?
Yeah, but I wanted to ask about our own personal experience.
That's what I was going to do.
Yeah, because
you should have trusted me in that beautiful...
You got to ask the last one, mate. My turn.
Oh, my goodness. Let's have a little sister fight right now.
She knows about us. But yeah, I mean, not only that's why I've loved talking to you, over the last couple of years, because Serena and I are having our own personal hormone journeys, but you've had yours, and you have been on hormones a lot longer than most people.
Oh yeah, I mean, I started using progesterone probably in my 30s for some of the symptoms that women have, hormone imbalance, and I did that. And I remember one time I felt, well, I feel fine. I think I can stop it, and I stopped it. I'm like, no, I need to get back on it. Yeah. And even my son, he was in high school, he would comment and say, Mom, how come you're always such in a good mood? And others moms, they get moody, And I was like, vitamin P or progesterone, you know what I mean, at the time. But anyway, but the testosterone thing. So, what I was reading about that was, well, the study showed it didn't matter what your testosterone level was because they didn't see a difference in libido. But I think what the issue was, they weren't getting it high enough. And that's why women weren't seeing a difference with it.
Bingo to that.
Yeah. But I'll say my own personal journey with that was, I had patients coming to me who we'd already fixed the estrogen deficiencies and the progesterone, but they were still struggling a lot with energy, muscle mass. Well, that's not as much their interest, but the biggest interest is libido, I'll be honest. And they said, I'm going out of state to get care. And a lot of them were getting hormone replacement out of state where that testosterone was more readily used. And my assistant at the time, she said, you need to go learn how to do this. You got to learn. And I'm like, okay, I'll go. Because I didn't want my patients to have to go out of state to get the care that they were getting. When I went, they recommend that you actually, if your levels are lower, that you just go ahead and start using it too. I felt like I was pretty good. I didn't feel that bad. I felt like I was doing okay. But once I got on it, it was a whole new world for me. A whole new world for me. Even from things like, not to get too personal, but definitely libido. Well, definitely libido. I was never somebody that had much, and it was just like, okay, whatever. And so to feel that way was like, wow, this is something. I've been missing this my whole life. Yes. But also the brain. Even though obviously I was taking care of people. I felt, competent to do that and no problems thinking about what to do. But it would take me a little while to come to that conclusion.
Yeah.
And when I was using testosterone, I was like, I could make decisions clearer. I just felt like I was, I don't know, more empowered, and just the energy was definitely there.
I love that.
So there's a stigma about testosterone for women. Many people think, well, it's a male hormone.
Yeah.
But, when we first started talking to you about testosterone, you said something to me that blew my mind. I had to go research to see if you were right, Dr. K. And you were right. Yeah. You said what to me?
I said, actually, while estrogen is we have more estrogen than men. Men have more testosterone than us. But women actually have more testosterone in their body than they have estrogen.
It's true.
When you look at that, because you don't see that because the numbers are measured picograms per milliliter. They have different denominators how it's measured, the numbers. So you can't compare a 1 to a 2, just absolute numbers. But if you break it down, women have more testosterone in their body when they're at their peak than they do estrogen.
I love that. And I love for women to know that, because there's such a fear.
Yeah.
And like, okay, if I take testosterone, I'm going to start growing whiskers and I'm going to turn like a man and my voice is going to get grovelly and I'll be aggressive. But I'm sitting here looking at you like one of the most feminine women I know.
Wow. Yeah.
Look feminine. Your whole nature is very feminine. And your testosterone numbers are robust.
Yes. And I have been on it since about 2016.
Yeah.
And
so
my levels are very
close
robust.
to 10 years.
Yes. Yeah. And most of my patients are that way. Yeah. Now there are going to be some people who have side effects, and we can talk about that more, but no, it doesn't turn women into, and people are afraid. They're like, I'm going to, become more manly looking and manly or irritable. Like you said, they think it makes you aggressive. When my levels get lower, I feel more irritable and aggressive.
And do you think that is because it's such an imbalance between the estrogen and the testosterone? Because I was reading lately how it can actually be, an imbalance of estrogen that can make you more aggressive than actually testosterone.
When women have too much estrogen, they really that's when they feel more
like when
irritable.
you're pregnant, right? You can get some aggressive mamas.
Yeah, and a lot of absolutely.
So I'd like to talk to you about that. When we were working on our Cure Hormone program, and we were spending many hours with you, and you were advising us. We understood. I was at first quite afraid of testosterone because I had used it in my perimenopause years, and
but when I was using the right stuff.
No, and I know I got very high, but my estrogen wasn't optimized at the time. I was really declining, and I felt that imbalance, and I was like, oh, Dr. K, I just don't know about testosterone for women. I'm just worried about it because isn't estrogen, the queen and everything. And then, we really came to understand that once we've got estrogen at that good, robust place, that's when you pour on the gravy, right?
Yes.
And the gravy is testosterone. So I feel like and would you agree, Dr. K, that a lot of the side effects of testosterone are because estrogen is just forgotten about?
I absolutely believe that. And in fact, when I first started treating more with testosterone, a lot of times women's symptoms of hot flashes would completely go away. So they felt okay. And so some women we wouldn't treat with estrogen because estrogen, as you know, estradiol, which not the estradiol so much, but the synthetics is the issue. But still, estrogen would get a bad rap too. Oh, it's going to cause breast cancer. Oh, it's going to cause you to gain weight. It's going to cause bloating. So women were afraid of that. So then we're like, well, they only wanted it testosterone. So a lot of people, there are people who only treat testosterone unless they just have to use some estrogen because it will treat a lot of those estrogen deficiency symptoms. Partly because it converts to estrogen, and some women a lot more than others. Yes. But anyway, yes. But I actually, in really working with you all, realized I was already using estrogen, but I started getting my levels on my patients and myself more robust, as you would say, and I saw less problems because I will say I've had some women that they actually have stopped the testosterone because there's some reason very sensitive to it and have had deepening of their voice.
Right.
And so, and then, that happens to women anyway as we get older. And it probably is a lack of the estrogen,
And as people get older too, they start to get stray hair.
Yes,
too.
they do, whether they're on hormones or not.
I've never touched hormonal therapy and they've got little hairs growing out.
Oh, yeah, they do that. And we don't know all the reasons why. I've always thought it's because the estrogen drops more than the testosterone initially.
Can I talk to you about that? Because
so have you found then that optimizing estrogen more robustly negates those side effects? It does,
very much so. Now, there's still some things we have to do a little differently, but yes, adding more estrogen helps relieve those symptoms, and I've seen that happen.
That's good. That's good.
Those side effects.
I wanted to get that final answer.
Wonderful. We just love you so much, so we're both like jealous of our questions to you. So it's like, my turn, mine. Okay, so I do want to talk to you about that whole thought you were starting to open up, and that's like, well, maybe testosterone isn't one of the first to tank. And I know that is like the knowledge out there, but experientially for us and for a lot of the women that we've tested on our kind of beta test for our program, it seems like in their early 40s, it starts to get below 20 or 20 and below, and leading to late perimenopause, it's like under 11. And which those numbers are extremely low. Yeah. And that's going to make people not feel very fantastic at all.
Right, yeah.
And so it seems like, even though they say usually it's progesterone to go first, then estrogen, and then testosterone the last, it seems like, and I don't know what's happened to the world, but that testosterone is one of the early ones to go.
I think what testosterone does, and this, honestly, this is based on just my experience of checking many, many levels and patients I'm treating, but even though the testosterone starts to drop, and a lot of that has to do with some things we do. When, like, women are on birth control, for instance, there drops their testosterone. Yes. And there are a lot of hormone disruptors in our environment, so that makes our levels worse. And I mean, there are 30-year-old women who have levels that are in the tank.
And I also heard too, and I don't mean to interrupt, but I feel like cortisol, and I think I read somewhere that cortisol can really tank testosterone. And that's that stress that a lot of people are under.
Oh, yes. And then also, too, once people have been under a lot of stress for a long period of time, then their cortisol levels drop, and then that further drops their hormones.
Yeah.
But I think that even though their levels drop, if I look at my patients who are not on any hormones, and they're 50 to 55, I'll see a lot of them that are undetectable in their estrogen, undetectable on their progesterone, and they still have some testosterone.
A little. Yeah.
So I think even though it can drop earlier on, it might hang in there a little longer.
It hangs in fat cells too, doesn't it? So if you have some fat cells, you might have it hanging on a little longer, but it's not in robust. It's not enough to give you a libido.
No.
When I went and got my hormones tested, I was still cycling and everything, and my estrogen and progesterone, they were, still in kind of like a late reproductive stage. But my testosterone was under 11, and I could tell because my gains in the gym, even just some of my balance in some of the movements, and just my desire to exercise.
People will say that a lot.
Was just in the loo, in the toilet.
People who work out a lot will really notice when their testosterone drops because they say my works are not as good. I don't feel like I'm doing as well. People who don't work out as much may not notice as much, but they even notice, hey, I've got a little more tone, and it's also good for your skin, which women love that.
We can talk about that. We're going to talk about its benefits, but I read a study that said, got it here in our testosterone chapter that will come out in our book, Trim Healthy Wisdom. But I believe it said by the time a woman is 40, usually the robust levels of your testosterone in her 20s is about halved. So let's say you were, 45 and when you were 21, you're about, 22, generally halved. So that's pretty interesting. Yeah. I definitely experienced that. When I was in my early 40s, I just wanted to see where my hormone levels were, and mine was, I think, 24, and so that's when I went on the testosterone for the first time, and I didn't know how to do it properly that time. Now I'm on testosterone, and it's just like the perfect gravy.
Yeah. I can't imagine my potatoes without that gravy. Like I'm telling you, the joy that testosterone brings to my life and to my marriage.
Yes.
Is incredible.
It's awesome. I have loved treating patients. What I've seen, literally, I've had patients say, "You've changed my life. My husband and I have fallen back in love again."
Oh. Yeah.
I mean, when you hear that, it's like I feel so much better. But that to hear somebody say it changed their relationship, that they've been married for years and that things have kind of gotten, and now it's like they are crazy about each other. And and it's not like they didn't love each other.
No.
But when you add that, it just adds.
It adds the spice. It's like a continual honeymoon.
And can we talk about this? Because I read something the other day that the clitoris in a woman is made out of the same tissue as the penis in men, and that it responds to T receptors. And when there's not enough testosterone, you can't get proper arousal.
Yes.
It's impossible.
Yes, that's true.
And so that's why when, as we get older, many of us women we no longer feel that need. We could take it or leave it.
Yeah.
But, I can say for sure when I'm on testosterone, my other hormones are balanced, I certainly don't want to leave it.
Yeah. And I can tell you another thing. Some women get alarmed because they will even notice the engorgement.
Yeah.
And they'll notice that it increases in size some.
Yeah.
But that is not dangerous.
No.
People get worried that there's a problem with that. I'm
Well,
like,
and oftentimes
it may bother somebody, but there's no reason that
and
that's a problem.
oftentimes the clitoris shrinks.
Oh yeah, it does.
There's a lot of atrophy in those places too when we allow the hormones to
And
take.
even the
Then they
tone
can't
of
feel
the
anything.
whole vaginal area. I mean, you're an OBGYN, right? I mean, testosterone has a profound effect on that, right? Along with
Absolutely. We hear a
estrogen.
lot about what estrogen does, but again, women can use just testosterone, and that will actually improve lubrication. It improves the fullness of the vaginal tissue. So we don't hear about that a lot, but it actually does do that. And that's why women feel like, oh, I don't need estrogen. And I'll tell you myself, when I was menopausal, had an estradiol level of less than 5, but my testosterone was very good. I felt fine. I didn't feel like I needed estrogen.
Yeah.
And I wasn't having a lot of side effects. And I think that's partly just my makeup. I never had a lot of acne. I never had a lot of hair growth.
Yeah.
And I don't have a lot of insulin resistance, which contributes to that. But when I learned more, as I started studying more and more about, wow, as you go past menopause, it's not just for symptom control. So even though I wasn't having hot flashes and I didn't feel like I needed estrogen for vaginal dryness, whatever, I got on it because of my health,
Your brain,
to
your
improve
breasts,
my
your
brain
bones.
health, to improve
Yeah.
yes, all of those things to keep me
heart.
healthier long term. Yeah.
That's so fantastic.
So some of the, like, I jotted down some of these things here, but what do you see with testosterone deficiency? Do you, if a woman is in perimenopause, let's say, do you commonly see that she could use some testosterone?
Yes,
When does it
I
start?
commonly see that. I mean, it can start even as young, as the early 30s. But I don't have very many people that are in their 20s that need that. No.
Yeah.
But 30s, 40s for sure. And some of the things that I see there are women who, like I said, unlike I was, but who said, I've always had a really good libido and now it's not so good.
Yes.
So that's one thing. Or the sensitivity part of it. I'm having a hard time having an orgasm. That's one thing. But then also fatigue. They just
that's
feel
a major one.
fatigued. And it's not going to fix everybody's fatigue. There are women, I just saw one the other day. Yeah, I was on testosterone. It did a lot for my other areas, but it didn't help the fatigue. She's got something else going on.
Yes,
Yeah.
of course. Sometimes thyroid, sometimes adrenals.
Exactly.
Yes.
So,
yeah.
but fatigue, mental clarity. I can't tell you how many people say brain fog that happens to them. And focus. You know, women who even have, you see maybe a little ADD kind of thing.
Yes.
Sometimes the testosterone really helps their focus.
I read once in a book called from Dr. Uzi Rice, and he's a wonderful father of hormones. And he was talking about he had a lawyer friend, a woman lawyer, and she would always a little bit higher on a dose of testosterone when she was having a day where she was having to defend in court. She'd be like, this ups my game. My mind is so sharp.
Yes.
Just that little extra dose, she would notice a difference.
And I think too, that we talked about the muscle mass.
Yes.
Women start losing muscle mass, and then their body shape changes.
Well,
And
it's so
more
interesting.
truncal obesity, that kind of thing.
Yes.
And testosterone.
And
helps
that's
that.
lack of estrogen too, right? That
right.
truncal obesity.
Yes, it's
Yeah.
both. It's both.
Yes.
But I did notice the testosterone because I've always loved exercise. Always. And like I said before, I just stopped. I stopped kind of like responding to anything I was doing. And then now just getting on a very nice conservative approach of testosterone, really. It's just the difference is night and day.
Yeah.
Night and day. Yeah.
Yeah, when I after menopause, I got my hormones tested, and my testosterone could not be detected. It was that low. Isn't that
wow,
horrible?
yeah.
But you're very
And-
petite, and I don't know if it's
yes,
that
and
body
I'm an
fat.
ectomorph, and I don't know. I didn't have a lot of body fat, so it wasn't storing anymore. It's just gone. It
Yeah.
was just goodbye. I had worked up to being able to do push-ups, and I had always worked out from my mid-20s. Do you know that I could not do one push-up?
Wow.
We
yeah.
had developed the whole Workins program, right? And some of them you jump off the ground, and I couldn't. It was so profound, its effect on the
Yeah.
fatigue in my body, that the workouts I used to be able to do, I just couldn't do it.
Yeah.
And I would dread it. I'll walk up the stairs
Even
like,
though you hadn't stopped
I
exercising.
hadn't stopped
just the
exercising. My body was just like, you don't know how.
Yeah.
And then, I got my estrogen optimized, I got my testosterone, and now I'm bad. I mean, I can get down and give you 25 male style push-ups,
All right,
It's
yes.
just like, it's a game changer.
Yes.
Of course, I had to work up to them again, but I could.
And again,
I could
do
do
you
it.
look manly? Do you look
No,
over muscly?
right.
No.
No.
So
Yeah.
I feel like, and just to say too, I mean, this is another one of those areas where they've been doing studies on testosterone for women for many, many years.
Yeah.
And I'm always wondering why, because I feel like we need to say, I feel like as a physician, I need to say, it's not FDA approved for women.
No, I know.
It is not FDA approved for women. And I don't know why it's not FDA approved for women by this point. But the only thing I can really think is I don't know. Okay, because I know there are studies. This has been going on. I've been going to conferences 10, 15 years ago talking about testosterone for women, and they were doing research on it, and they were seeing positive benefits. But I think it's because it's when you get something FDA approved and a company wants to bring it to market, they have to have just a few doses probably.
Right.
And I think it's difficult to treat a mass amount of women with a few doses and just that. And I feel like you have to have a more personalized approach to it. Right. So maybe that's why. I don't know why. Yeah. But women get worried about the testosterone because it's not FDA approved either. But I will just say it is very safe, and it's not going to increase their risk of breast cancer. There's never been any studies that show that. It doesn't increase. Now, I will say there was a form in methyl testosterone in Covarix and in Estrotest. And so that was FDA approved. Okay, but that was methyl testosterone. But unfortunately, methyl testosterone being synthetic has some negative effects on the liver. So you don't see that used very much anymore. But I just wanted to touch base on that because someone maybe learned it.
And I think, so sorry,
you go ahead.
But I think also the other fear is this, maybe some social media or where women have seen other women maybe in the sports arenas where they are definitely on super physiological androgens. Mm-hmm. And so it's not even in a level that would be even good for a man, and a woman is taking it, and their body does change, and they almost look what is that what is that word? Neophilandical, like their face changes, everything changes. But that is not normal human levels. I mean that is definitely.
But we're also unique, right? And that's why it was so great to have you helping us, advise for our whole Kiora program, and testosterone is a big part of that. We lay the foundation of estrogen, progesterone for protection, and then comes in that testosterone, but it's so unique to each woman, and that's what we've discussed. Like some women, they feel completely optimized and their levels get like 80 to 100 and they're like, oh my goodness, it's fantastic. And other women, we've seen, I feel good when I'm about 300.
Yeah.
And I love that we've had Dr. K, in on that collaboration, because she's put the beautiful safe parameters. Mm-hmm. So we have nice safe cutoff points. So anyone on our program, they're going to be in that safety.
Mm-hmm. Yeah, but it is unique to each woman. We all experience that level where we feel optimize. I feel like so differently. Have you experienced that with your patients?
Oh, absolutely.
Over the last
some
20
people,
years?
You don't have to do much. Some people, I just have to get them to the upper end of what's considered reference range, maybe 50. They went from 20 to 50 and they feel really good. Other women, they need much higher levels. And then sometimes, it depends on when you check the labs too. Yeah. They'll get very high levels and they have no negative side effects. They feel very good. And I used to be honest, like, well, it's a little high. You know what? But what's bad about it? There's nothing bad about it.
And can I ask you about that little high? Because I feel like we need to address this too for people that notice that maybe they've got higher levels now to feel good than maybe if they tested them in their premenopausal stage and they saw a certain number and they were just in their prime feel good.
Maybe it was like 38.
Yes, and now they don't feel that same 38 feel goods until they're 200. Mm-hmm. Can you touch on the fact that's because endogenous production is going to be different than the exogenous, which is coming from the outside, even though it's identical to the body, and the receptors have kind of fallen asleep. Would you explain that to our people?
That's what happens. I think a big part of it is the receptors. Receptors are not as sensitive as they used to be. And sometimes it's because they can get mucked up by all the different, toxins and things that we're exposed to all the time that we can't get away from. And so they just need, and the older we are, and the further we are in our lifespan and our menopause or our hormone, journey, we've been exposed to more things, and so our receptors are not as sensitive. And I think that's probably one of the biggest reasons for that.
Right. So, for clarification, so they might have to have a much higher number on exogenous help than they did by their own body.
On their own body. Yes.
Yeah. I think a lot of people are aghast, when they see a woman, maybe she's postmenopausal and her testosterone levels come back at let's just say 290, and everyone's like, hey, some men at the same age are only like 300. You're having levels of a man, but it's not. So
it's not the same.
It's not the same.
Not the same. And yeah, it makes me think about it's kind of like the thyroid, but we won't get into the thyroid today. Yeah. But I think that's absolutely what's happening with that.
Yeah, I think another thing that I've looked into in the studies is that testosterone is amazing for skin as we age.
Yes, and that's why we're so jealous of most men our age who have the baby face skin.
Yeah.
Because of their high testosterone. Like,
Yes.
it seems like women's face start to age sooner than men's.
And,
Yes.
and of course it's estrogen too, but like the thinning that happens in the vaginal area, the skin
Yes.
tissue is similar, right?
Yes, they do. You decrease your collagen, your skin gets
Yes.
thinner. That's why we see the blood vessels more easily and all that. So
Oh, really? Okay,
Yeah.
my blood vessels.
That's interesting.
I've never heard that, Dr. K.
well, your skin is thinner. You're going to see it more. You're going to bruise
Oh my
more.
goodness, because I
that
just
kind of
kept
thing.
wondering as I got in perimenopause and postmenopause before I started optimizing, I'm like, why am I so veiny these days?
Yes.
I'm so veiny.
Yeah, and I
Wow.
think even though you're on the testosterone, it's
Yes.
going to prevent it from getting worse. But
Yeah,
yes,
but
that
it's
makes a
probably
difference.
not going to.
100%. Yeah.
Yeah, but I have noticed since being on exogenous testosterone that my skin has thickened, dermal skin has thickened on my skin. It's definitely stopped the aging.
Thinning.
Right.
Yeah.
So it works in synergy,
Or
with the
slowed it down.
estrogen too, because estrogen is doing that also.
Can we get back to the thing? And this really, I guess, irritates me too, but hopefully things will change. I feel like there's a change in the air coming, Dr. K, with hormones. I feel like
Oh, I
women
do
are
too.
speaking up.
Yeah, I do
Some
too.
more and more doctors are coming along to seeing it the way that, but there's still not enough the way
Yeah.
that you do. But, okay, so, there's compounded formulas. Our Cure program at first is going to be all compounded. Eventually we may go into the traditional methods, but if a
Not
woman
synthetic traditional.
no, but I'm talking about just like an estradiol patch.
Yes.
That is for
Yeah.
a woman who does not have estrogen, right?
Right.
And so that is, you can get that covered by insurance,
Yes.
right?
Yes.
And I love that that's there.
Yeah.
And then progesterone, you can get oral progesterone covered by insurance.
Yes.
And most doctors, if you harp on them, if you say, listen, I need this, hopefully they will say, okay.
Yeah, because we get trained, you don't need progesterone unless
Yeah.
if you have had a hysterectomy, because
Yes.
it's only to protect the lining of the uterus, and you absolutely need it if you're on estrogen and you have your uterus. But progesterone, we have progesterone receptors throughout the body, not
Yes.
just in our uterus.
Yeah, tell that to somebody who can't sleep at night, and then they've
Oh,
finally
my
tried
goodness,
bioidentical
yes.
progesterone, and they have like the best sleep of their life.
Yes, absolutely.
However, when it comes to testosterone,
Yeah.
which is, usually tanked as well in these years, as we've discussed,
Mm-hmm.
there's no way a woman can basically get that from
No
her
way.
OBGYN.
No way.
So we need
No.
to fight for the
Frustrating. So they're going to
freedom of-
have to pay out of pocket for
Yeah.
it somewhere and go to perhaps another doctor like you who will do it. Most
Mm-hmm.
won't. I mean, it's really, it's quite tragic.
Yeah.
If somebody tried to take your testosterone away from you right
Oh
now,
my goodness.
would it be like,
No, I would
you'd rather
Yeah.
almost have them take your car away?
Yes. No, take my car.
And my coffee
Yeah.
maker.
Yeah.
My Breville
Ooh,
even.
Ooh, yeah.
Ooh, that's a tough
No,
one.
no,
That's a
take
big
my
one.
Breville.
No,
My marriage is too exciting.
You are
with
not
testosterone.
taking my testosterone out of my. Oh man, what would you do?
I know that's really difficult. I mean,
Do you
that's,
have a Breville?
no, I don't
Oh
have a
my
Breville.
goodness! But you have testosterone. See, she
So
knows
there you
the
go.
right
I mean,
priorities.
But I mean, there's been some concern, in the compound community that may become more and more regulated, maybe not be available,
I know.
and that would be really, oh man, what
I
would we do?
cannot imagine
Yeah.
going back to my workouts without, and especially without testosterone. Especially for women like me. I don't know. I'm an ectomorph. It's so hard my whole life to gain any muscles, and then I lost muscle so fast when I went through my late peri and postmenopausal years. But I don't know. Are you an ectomorph or are you a mesomorph?
Gosh, you know what? I think I'm more of a mesomorph.
Yes,
but I'm
okay.
not 100%, but that's what I would say.
Yes, okay,
Yeah.
but you're kind of petite, but you don't have trouble building muscle as much.
I don't build it that well. Not
Yeah.
like Serene.
Yeah,
you
Serene's
know,
a
but
very
and
quite
yes,
quite
but
the meso.
in perimenopause,
Yeah, you lost it.
I was losing it rapidly and exercising daily and doing lifting and losing it rapidly. So I think it's not just about mesomorph, it's the hormones behind it somehow.
But if
there
you're
are
an
people who build
ectomorph
it
like
easy.
me
Yeah.
and you go through menopause and your testosterone is less than 0, Serene, if you tried to take away my test, I don't know what I would do.
Yeah.
So what
I
are we
wouldn't
gonna
be able
do?
to function because it was that bad for me, Dr. K.
We have to be a voice and we have to start being vocal about it because, like I said before, there is a lot of force coming against these hormones that make women feel so good that they don't need to be on drugs.
Yes.
Pharmaceutical
Oh
drugs.
my goodness, can I tell you, we didn't even talk about this yet, but I have had women who have severe, say, arthritis.
Yeah.
I have had patients who had to retire from work
Yeah.
because they hurt so much all the time. A lot of it's arthritis, osteoarthritis, even some rheumatoid arthritis. They were able to go back to work when they got on testosterone because
goosebumps.
it really helps their pain. Now, estrogen plays a role in that too,
Yeah.
but literally, have treated that. And I thought of another option, story like that. But there's so many things like that women are able to do so much better with that testosterone.
Yeah, I know. Sometimes we think, just libido, but it's so beyond libido.
But even if it just was libido, sign me up.
Yeah.
Yeah. But, if I was single, because, everyone's different with what they want for libido.
Yeah.
And if I was single, I wouldn't want distracting thoughts all day long. I'd feel frustrated.
True.
So what do you do about maybe single women? I feel like they still need some testosterone.
I just try to make sure, just find that spot where they are still getting some testosterone, but it's not really. And there are women who are even, some women tell you got to back down with testosterone. My husband says this is a little too much now. I'm serious.
I have been there.
Yeah.
Oh,
so, yeah. So we just have to monitor that. And I always warn women. I say, look, you need to be aware of this. This could be an issue. But I think, now this is just me thinking this and what my experience is, but for a lot of women, if they don't have a relationship, if they don't have a spouse or them they're in love with, they're not feeling that as much.
Right, that's true.
They're really okay.
So they
You're
can
with
be
your man
higher
all day.
levels.
And they don't have that huge.
Right, because libido is mental too. So when you combine mental with the hormone therapy,
and when you're in love, you want to be with that person.
Yeah.
Yeah, but I don't. Yeah, I like I'll just be open. My T level right now currently is about 200, and I like it there. I'm not like, how you can like be chasing your man and wearing him out. I'm not there. Yeah. But it feels really good. Like it feels like I could be in the mood in a minute.
Yeah, I remember. I can't remember who it was now. Not too long ago, one of my patients said, "Well, I have a lot more empathy now for my 18-year-old son.
Yeah.
Because you feel like, oh, now I can see why this is challenging. Because you have those feelings.
Yeah.
So, but you touched on something earlier about the mood too, and I meant to say this is what I was going to say and I forgot. But women who are on antidepressants, not that people shouldn't be on antidepressants, right? But some of my patients have been able to stop their antidepressants when they take the hormones, and a lot of it is the testosterone.
Yeah, do you know I'm around my young 18 to 20 something sons. There is just a positivity around that kind of testosterone surge where they just, I can surpass anything, I can overcome anything, like they wake up and there's just like this natural positivity and excitement that must be testosterone. Because then you get androgen in men and it's grumpy old man. It's not the same.
Yeah, men have their sense of lack of hormones too. Yeah, and you can see a difference.
Well, speaking of men, then you get a lot of women optimized hormonally, and then they're like, "Oh, I feel libido again." And you've said marriage is coming together. Well, what happens if a man say, he's in his 50s, 60s, and he's on his decline? Do you see women saying, "I got to get my husband optimized"?
Yes.
Do you help optimize them, or you send them somewhere else?
Well, there's a very few. I'm a gynecology clinic,
right.
so
you're not
that I have a few, and I know how to treat men.
Yes.
But there are other places that I can send them
but
to.
You've experienced that, a lot of wives saying, "Okay, now I got to get my husband optimized."
Yes, absolutely, yes. That
I
makes
wouldn't like to be what I am right now, and my husband not on testosterone. My husband's been on testosterone for a long time, but I wouldn't like that imbalance.
No, that's very challenging. Yeah.
I agree.
Yeah. And like I said, it's not just, and for men, it can be energy. It can be, I know we're not necessarily talking about men, but you notice a big difference for them too, with energy, mood getting better.
Yes.
I guess I'll just say it. You talk about Charlie. Yeah. Kim uses testosterone.
Your husband,
and once he got on testosterone, my mother said, we went on a trip together. I've never seen Kim be in such a good mood.
That's great.
Because he's just always in a much better, And so I think
that's a funny statement from a mother-in-law.
Yes, yes.
Just being personal then, our dad, he's in his 80s.
Yeah.
And he wasn't on testosterone for a while because he couldn't find a doctor to prescribe it because he has an enlarged prostate. But he finally found this integrative doctor who was like, I know testosterone does not cause prostate cancer. I don't care what any of the studies say. It's...
Well, it actually hasn't shown studies.
Yeah.
It's actually, the studies don't
what
say
I'm saying
that.
Is
but there's a fear.
The fear that, there's a stigma like studies show it, but they don't. There is this kind of like gray shadow out there that kind of says it causes cancer, but it doesn't. So this lady's like, I'm totally confident in giving your father. So at 80-something, he's finally on testosterone therapy. And I said to Pearl the other day, have you ever seen Dad's face so shining?
Yeah.
Like he's always been a positive guy,
positive.
but he is 100%.
Yeah.
Like he's like definitely on the positivo side.
Yeah, and I didn't mean to make it sound like my husband's grumpy all the time. It's just that it was consistently in such a great mood, no matter if we got stuck in traffic or whatever.
No.
I
know what you're talking about. Yeah.
I do have to say the other side of the coin, the reality, sometimes, we're talking about all the benefits, and yes, like when I got my hormones optimized, and I went fully through menopause, so I experienced the other side of it. So you're not going to, Serene. You kind of optimized before you went through menopause.
But I remember you going through the valley of the shadow,
shadow
of
menopause. Oh, man. But so I've experienced that, and then I got on hormones, and I felt, I felt this light. I felt better in my skin, and all these things happened. But that's not to say when you have testosterone, estrogen, all that, there won't be bad days.
Yeah.
Like I still have times where I have to kind of go to the Bible and lift myself up and things like
daily
that.
For me.
And some people think, well, hey, I'm on estrogen, I'm on testosterone, I'm still in a bad mood. Sometimes there's just human nature too, right?
Right. There's other things going on. Absolutely.
But it does give us that foundation.
And you're feeding your human nature, the way you think. It just keeps, if you're in a chain of thinking a certain way, the testosterone and estrogen and progesterone aren't necessarily going to change your thought pathways. I just think, Pearl, when I noticed you, like I said, going through the shadow of the darkness of menopause, you were more of the journaler and the thinker at that time, and more of the, like, I could tell you were propping yourself up, like, the sky is blue, and the trees are green, and I remember you getting onto but you told yourself and you lifted yourself up. But when you were on the hormone therapy, you were like, I wake up and I just, the sky is blue. I don't even have to, I don't have to cheerlead anything, but it's just.
But that's actually a good thing. What about then? I experienced menopause, and it was tough for me. It was a very tough season. I experienced a lot of physical depletions. Like I had the hot flashes, everything you could, go through menopause, I experienced. Some women don't, Dr. K.
Yeah.
They go through and they're like, well, why would I need hormones? I totally feel fine. No hot flashes. My mood's good. As I've researched, I've come to understand, brain, bones, and heart. But could you speak a little about that?
Oh, well, yeah, that's brain, bones, and heart. Yeah. Oh, man, I'm glad you brought up that whole conversation but now I will say, for bones, yes, testosterone can be beneficial.
Yeah.
But still your biggest actor is going to be your estrogen.
Yes.
You're still going to, and I love when I see a woman who's got osteoporosis. I mean, I've had patients, I don't know if you know, osteoporosis, you have a T-score negative 2.5. It's below 2.5 standard deviations. We have people who are less than 3. I mean, it's severe osteoporosis. And getting on hormones, I have seen them improve to even some reversing osteoporosis.
Wow.
You don't even see that with some of the medications. You see stabilization, you see some improvement. But as far, I consider it, gold standard for that. And it's just so remarkable. And they're also helping themselves in so many ways. Yes. So, and I will just say, I mean, if somebody's afraid of hormones, if they are still just very uneasy, I'm never going to try to talk somebody into it because, I just want to let them know the option. And there have been people I've kind of just walked through, okay, this causes this causes this, this causes this could cause that. And they just go through all the, options. But yes, the bones, and then, cholesterol. Yeah. Now, testosterone seems to be somewhat neutral on that. You're not going to see your cholesterol improve necessarily with getting on testosterone. Some people you might. But estrogen, I have literally seen people go from 250 on their total cholesterol to 190, and all they did is they got on estrogen.
You told me that when we were talking about a whole cure program. And then we started our testing, and we have done observational testing on women now for over a year. Well, that very thing has happened. So cholesterol has come down. It's not instant though, is it? Because we just got a message from one of our, people on our Alpha program. She's like, look at my cholesterol numbers. I've always had a problem with cholesterol, and I've never had this good a number, and I've done nothing different.
Nothing different. Wow. And like I said, again, we always have the disclaimer. Yeah. It's not going to happen with everybody. There's some people who are going to have higher.
Of course.
But yes, I mean, I'm just thinking of a lady right now, and hers was within 3 months, and like she was kind of continue. I think her doctor had prescribed a statin. She wasn't sure about the statin. She wanted it, but it came down. Normalized, and the HDL oftentimes goes up, the good cholesterol.
Yes.
And then the other big thing is literally I've seen people go from their, A1C being elevated. Yes. I think of this patient's pharmacist. She came in 5.8, which is just, a little bit pre-diabetes.
It is.
Not diabetic, but still, I don't like it. I don't like to see pre-diabetes at all. I want those levels down, because we know the higher the A1C, there's evidence that shows the higher the A1C, the higher the risk of dementia. So you just don't.
Isn't that interesting?
Yes.
Is it because dementia, Alzheimer's, they're calling it now a diabetes type 3?
Brain. Yes. So anyway, but and she said, I did nothing different. 6 months later, I think it was, A1C was 5.2. She said, I did not change my diet. I did not change my exercise.
Wow.
This is where I am.
I can speak to that too because I am. This is really incredible. When I went through, I always had great A1C, from healthy diet, everything.
Yeah.
Then I went through menopause. And it was just my hormones that declined. And my, Pearl, the founder of THM, was having her A1C jump up to 5.5, I think. And it was always like 5.0, 5.1.
Yeah, and a lot of women would say, oh, it's normal, it's 5.5. But if it goes from 5.0 to 5.5.
No, that wasn't me.
Right.
And so then I'm like, oh, man, what am I doing wrong? What do I have to tweak?
I remember you calling me an absolute freak out.
I was like, do I have to eat less carbs? I don't know. I love my carbs. What am I going to do? Got on hormones. I'm back to, I'm a 5.1. I love being there.
That's great.
So, I mean, that's, I'm just living testimony. That's why I'm saying you can't drag my hormone cream away from me.
Right.
Cold, dead hands I'm holding. But, but what about that brain? Now we're talking broader. We've kind of discussed testosterone, but can we talk brain? Because... I mean, that's why we like to get...
And we talked already that testosterone does keep the brain more alert and more focused. But let's
for women that say,
sense that feeling,
for women that are like, but I don't have these symptoms. Why? Convince me why. And we don't want to convince anyone, but why do we need hormones?
We don't
for
want to
our
convince,
brain?
but we want to educate. We jolly well want to educate.
Yes, absolutely right. And you'll see some differences of thought in the literature. As far as hormones and dementia, for instance. But generally, what you see is the studies that have shown increased risk of dementia with hormones has been when people are taking norethindrone or the synthetic progestins. So it's not so much the estrogen as the synthetic progestin that's been associated with that. And then there's other data and other studies and other evidence of estrogen helping to prevent dementia. So I don't know that right now you can say a blanket policy statement. If you take hormones, you're
No,
we're not going to say you're not going to get dementia.
Absolutely.
But because it affects all those other things that do affect dementia, cholesterol comes down, your A1C comes down. And I think just endogenously there have been people that have done some looking at the brain and the brain imaging changes.
Right.
The brain starts to shrink. And it does that less in women.
And we
they
just have to realize you
Yeah.
don't really see. On a whole, maybe there is in some children that have some neurological like damage and things like that, or conditions, but you don't see normal dementia until in men and women until hormone depletion, until the menopause and andropause.
Right.
Yeah. And, I read a study that showed even in the study, I was actually looking at the images of the brain that showed that they took a group of women without...
The X brain, the book?
Oh, well, that was the book, but then I went and looked up some of the studies. They showed the brains and they took a group of postmenopausal women not on hormone therapy and then on hormone therapy. I believe they got them up to 2 milligrams of estradiol.
Yes.
And they were showing regrowth of the brain. And the ones... Actually, there were 3 groups of women. You probably read it. Without hormone therapy on a 1 milligram, then those on a 2 milligram. So there was no regrowth in the ones not taking it. There was no regrowth in the ones on 1 milligram, but it was the 2 milligram woman that showed the regrowth.
Yes, and it was that data really that made me to say, I know I don't have hot flashes. Yeah. And I would not normally think I need estrogen.
Yes.
But that's why I'm taking estrogen.
Yes.
Is because that's the biggest reason right there. Now, probably other benefits, cholesterol, A1C would have been important too to me. Yeah. But the biggest reason when I read that, I was like, okay, I'm taking that.
And I want to say too, you were saying how, and it sounds like I'm going off topic, but I'm not. How you were saying how, you had, you knew of patients that had to stop work because of pain.
Yeah.
Osteoarthritis and rheumatoid arthritis, and then they got on testosterone, they could go back to work. But I feel like there are probably stories out there, and I don't know, somebody, maybe it was you that mentioned it, how when estrogen is depleted, some women are having to they're either getting fired or they're having to stop their job, especially if it was a high like brain powered job, and they cannot be at their A game anymore after menopause.
They feel that way.
They almost like think, this isn't for me, before I better retire.
And then what kind of depression can that lead to?
Right.
Too.
And that was estrogen depleting.
Or even feel like, what's wrong with me?
Yeah.
And because some women don't experience it that same as some women do. Or they're in a meeting and they're starting having sweating and all that. It's very disruptive to their work.
And I remember you telling me too, and that's why I kind of jumped on the train of hormonal replacement even before menopause, because you're like, Serene, little sister, let me have a little couch talk to you. Can you not do what I did, where you wait for menopause? And of course, it's not too late for anyone, even like our dad who's in his 80s starting to get hormonal help.
Yeah.
But it's never too late. But she's like, I'm happy to, it's getting better now. My word recall is getting better. But I felt some brain fog, she said.
Oh, it was worse than brain fog for me. As I said, I experienced very terrible menopausal symptoms. I was worried. I thought I was getting early dementia for a while. My word recall, I mean, I would look at people I know, I couldn't even recall their names. It was scary. It's coming back now, but it was terrible. But before we close, we've only got a few minutes left.
It feels like 2 minutes with Dr. K.
Yeah.
Have fun.
It's gone too quick.
Has it been rewarding then all these years?
Yes.
With treating women with hormones?
Absolutely.
Is that why you're still doing it?
Yes, absolutely. And I have somebody, when somebody comes in and says, wow, it's life changing. I'm a new person. All the different ways it's changed their life. Then it's so rewarding. In fact, as you mentioned before, I've got some other responsibilities right now. And the thought is, do I need to keep working? Do I have time to do all the things I've been doing? But even my daughter who works with me, she's a nurse, and she said, Mom, you never need to quit seeing patients and practicing it with hormones and just in general. She goes, because that's your dopamine rush. When somebody comes in and they're like, wow, I feel so much better. It's changed this, it's changed that. And I'm so much, then I'm like, just even the fact women who, say for instance, who had pain every time they try to have sex, just the fact they're like, no, it's great now. Wow, rewarding is that?
Wow,
and so for me, that just gives me a big, it's so happy. It makes me so.
And before we go then,
that's
go
something
ahead.
that we need to, it's not even just about libido. Libido's gravy. That's fantastic. But to not go through almost trauma because of pain.
Right. Absolutely.
And that's hard for the husband too. He doesn't want to give his wife pain and trauma when they're making love.
Yes. And, it's so true. And it just made, when you ask that question, made me think too, one of my colleagues has started doing more with hormones. And sometimes she'll come ask me a question about something. And she came around and told me about this patient who came from like 2 hours away to come see her to get started on some hormones because she didn't have anybody locally who would treat her from, I can't remember the situation, but a lot of times people are afraid, unless you're just picture perfect example of somebody who can take it. If you have any kind of, had some kind of health history or something, they think you can't do it, which you can. Yeah. But anyway, and she said it changed her life. And and she's experiencing that too. And I'm so excited because when she gets that bug and sees how she can help women like that, then it's going to grow.
We have this bug.
Yes, it's a bug.
We're spreading this message. And that's why we created this whole program. And there's been such a need.
Dr. K.
We at first, with Dr. K, we were like, oh, can we send people your way, Dr. K? We don't have anyone. People to fill up here, the ones that, here in our local Nashville area. We had
a year waiting list.
Wonderful woman that we knew treated hormones. We sent all our friends there. She's full up, can't take any more. We're like, can we send people to you? And you're like, no, I can't see people out of state. And so, we're creating this online hormone platform. But
you get the wisdom of Dr. K.
Yes, but I do want to say this. So many women do go on hormones for a while because, they have symptoms, maybe like me, and they're just going through it. And then their doctors tell them to stop.
Yes, I'm so glad you brought that up.
Do you treat older patients? Do you continue?
Yes. Well, and, again, I'm always going to be very understanding, and you're not going to try to change some, yes, I want to educate. But if they don't feel comfortable, then I don't, want to push anything on anybody. But I usually tell them what my answer is. I'm like, I'm not going to stop unless there's something drastically changes. I'm not planning on stopping ever.
And would you tell us the reason why you think they say go on it just for symptom control for the littlest time possible? What is their thinking?
I think that's based on some of the studies that showed over long term an increased risk. But again, if you look back, those data came from synthetic progestin.
It did.
So I think that's where that comes from. But it's still the thought. A lot of people think don't take it after 65. But I will say things are changing even in the larger organization like the Menopause Society. It used to be North American Menopause, but now Menopause Society. I mean, they've come out with a position statement and it says all case mortality in women is lower in women who take hormones. All case, even that's the national organization. All case mortality is lower, and that we don't care. We care about mortality, but we want quality of life too. But even looking at that, I mean, so that's a change. And so they're saying there are reasons that you can continue, but still, kind of the standard has been you stop. And I think it's just based on those studies.
Do you treat some older women? Do you have some in your 70s?
I do. I have one patient, a very well informed patient, and a husband has passed away, but he was a physician. She's in her 80s.
Yeah,
and that's very not typical treatment. Right. But she came and asked. She understands all, and you have to make sure that they understand all what the data has said, risk and benefits, all that. And she's like, I feel so much better. And so, I'm treating her.
Well, you wouldn't take the hormones out of her mum either. And she's in her mid-80s now. From her cold hands, people say you can't take it. You know, and she wouldn't stop even if you
Oh,
said,
our mums are vigorous.
Well,
She
you
can
can
beat
see
me
a
in an arm
difference.
wrestle.
Yeah, I can see women. I think they're not on hormones. I'm so sad because I can tell by looking at some women that I feel like.
Is that right, Dr. K?
Do you remember, Dr. K, our mum came to you for a little bit because, you know, she had an injury and had a prolapse. You know, she had twins and then she was like lifting these heavy boxes and she felt the ligament snap. So she'd been dealing with a prolapse for a while. And we were wanting to take her to Scotland and go hiking up these big, you know, Highland mountains, hills or whatever. And you were trying to help her with a little help there to keep everything kind of in. And when we went to Scotland, she's in her mid-80s. She climbed the Devil's Staircase.
Wow.
Yes. So it was like there was people in their 20s stopping halfway because they were too tired. But she's been on hormones for now, what, 15 or 20
At
years?
least, at least 15
She
years.
made it to the top in her mid,
Wow.
in her, like
That's
she was
amazing.
83,
But
84
mum
at the
likes,
time.
mum
So
likes
vigorous.
her testosterone high. She
Yeah.
feels
Yes.
Yeah.
She
I remember we
likes
talked
it
about that
high.
before, and I was like, it's okay, really
Yeah,
okay.
we're like, hey, our mum's testosterone a little high. She's like, just
Yeah.
Thank you for helping her because she was able to climb to the top
That's
of that
awesome.
hill there. With,
Yeah, well, thank you,
but I've
Dr. K.
even seen people too who were like, I almost, before I became more enlightened, you know, wanted them to come off their hormones and they never would let me take them off. And now look, I'm saying, thank you so much. I'm so grateful that you kind of just, you know, got through that and you didn't stop taking them even when I was even suggesting it years ago. So anyway.
We so appreciate you stopping by, coming in here to the old barn, and we just love you. We love your friendship, and thank you for all you do. You do.
Think about this, Dr. K, this old barn. Usually when we have anyone come, they have to walk through the cow sludge to get up
well,
here.
last time she did. Yeah.
Well, we rolled out the red carpet for you. I
Thank
noticed
you.
that
I
Pearl
saw
had
that.
put stones just for
Beautiful.
you to break your shoes.
The gravel
Thank
was for
you.
Dr. K. She's coming back.
Wow,
She deserves
thank
some
you.
gravel, not mud slosh.
Well,
on
I
your-
would come regardless. I love visiting with y'all.
Well,
being here
thanks.
together.
We'll hopefully do it again.
Yes, thank you.
you.